It's my feel-good breakfast show.
Now we look at putting back into our bodies all the nutrients that life takes out, especially when going through those vital life stages like pregnancy. And we've been treated to a front row seat, of course, with Alana and the process that she's gone through. And I've picked up a lot of really interesting information. It is so important to get the right nutrients in. In fact, it is vital, as Andrea would say. And we are looking at some very healthy ingredients, but let's focus on pregnancy with the changes that are going on within a woman's body, the vital nutrients. What stands out?
Well, essentially, a woman that is pregnant is growing a new life. And the growth, development needs and all of that for the woman's body, but also for the baby, is really high, and it's difficult to get to all those nutritional requirements through a normal healthy diet. So we're going to point out which foods are absolutely critical and which nutrients we should get in.
I'm going to jump right out there and say folic acid, because that seems to be one term that I've heard so much over the last couple of months. Why is folic acid so vital?
Well, folic acid plays a critical role in the development of the nervous system. And folic acid foliage, you know, we get it in dark green leafy vegetables.
Spinaches and kales and such, yeah.
That's right. And also in Brussels sprouts, so most of the dark green leafy vegetables are packed with folic acid, but also lentils are rich in folic acid. But most women take a folic acid supplement. And sometimes there's a bit of confusion. It's always good to check with your doctor first. Yeah. But the Vital Pregnant Women supplement is specifically designed as a multivitamin with more than sufficient folic acid inside that supplement. Okay. So if you take the Vital Pregnant Women Plus, you don't have to supplement with additional folic acid.
Okay, what other nutrients do we need to take in?
Well, calcium is the other one that's really important, so that's why we've got some yogurt here. The absorption of calcium out of vegetables like spinach and even out of milk sometimes is a bit tricky. We don't get all the calcium into our bodies. So the calcium in yogurt is more bioavailable or absorbable.
Okay, I like that, bioavailable. I like that. So if we are suffering from a deficiency in calcium, when do we supplement? How much should we be supplementing?
If you look at what we can consume through our diets, they say for the first 3 to 4 months it's fine, but after the 4th month of pregnancy, it's recommended to supplement and throughout breastfeeding. Okay. A woman's body produces 1.5 liters of milk when she's breastfeeding, and it's hard to get enough calcium out of your own diet
to match that.
Yeah. And then omega, obviously very important for brain health and brain development. So omega-3 fatty acids. Once again, it's easier to obtain these through a supplement. Sometimes women are advised not to eat too much fish during pregnancy for the risk of the fish being contaminated with
the bacterial
mercury
content as well,
and bacteria. So the safe option in terms of mercury and heavy metals and also bacteria are these omega-3 fatty acid supplements, because they are tested and pure and perfectly safe during pregnancy.
And obviously designed in a way so that the body can really absorb them.
Yes.
Any tip to round all of this up for someone who is going down this incredible new journey?
Yes, the first meal of the day is the most important. I know nausea is a problem, but it's important not to skip breakfast. So probably the healthiest breakfast you can get is an unbaked raw muesli, like the Vital Low GI muesli. So that either with milk or with yogurt really will be a good nutritious start for the day.
All right, now I know a lot of pregnant women out there looking for just a shoulder to cry on or someone to plug into to get this vital information. How can people connect with you?
Well, I answer questions on Facebook. So while you're on Facebook, you can search Andrea du Plessis Vital Expert.
What would you say is the question you ask the most when it comes to pregnancy?
Omega-3 fatty acids. How much do I need? When should I start? So that is very important.
Can you take too much?
You can take too much. If you take more than 6,000 milligrams per day, that would be 6 large capsules a day, which is unlikely. You can get a bit of digestive upset, but it's nothing that will be harmful for you.
I love it. The tome of knowledge that is Andrea. Thank you so much. And thank you for taking your job so seriously when it comes to offering this advice to our viewers. I think people really do appreciate it. Thank you very much.
You're welcome.
Well, there you have it. There are some very useful, very wise tips you can take on board. If you are a pregnant woman or approaching pregnancy, there are some vital changes you do need to make in terms of your diet. And you can connect with Andrea on Facebook. You can also post those questions on our Expresso Facebook page.
Healthy living is easy with the Vital Club. Join before the end of February and you could win a Vital product hamper. Visit vital.coza to join.